Occupational English Test. Listening test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to Linda, a woman who has lower back pain. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi there, Linda. My name is Sia, and I am one of the physiotherapists here.
Hi Sia.
How could I help you today?
I've been getting a pain in my lower back, on the left side, around my hip and through the bum cheek area, when I'm running especially.
Okay, how long has this been going on for?
It's something I've had on and off for years. And it started off as just a kind of dull pain, and now it really feels like it's spasming or something. It hurts even when I put weight on my left leg. Usually I feel it start, and if I kind of lie on a tennis ball and massage through the muscle, it goes away. But lately it's just been getting worse, and I can feel it sort of tight through my whole hip area. And I can also feel it kind of even when I'm sitting and sleeping, or at night when I'm trying to sleep. If I roll I feel a kind of, it's hard to explain, it's like a shooting pain that travels down my leg.
Okay, so the shooting pain, where does that go?
It starts in the same place, and it goes like down the back of my leg, kinda through the back of my knee, and sometimes down to my ankle area. The pain also aggravates while doing exercises.
Okay. Are there particular exercises that do it?
Mostly, while running and walking. I think walking is even worse, actually.
Interesting. How long can you walk for before the pain starts?
I don't know. I kinda don't notice it when I'm walking, it's when I stop and then start again, like, yeah. So, I guess if I walked for. I'm a middle school teacher for the past 10 years and I walk every day to work. For example, which is about 45 minutes each way, and then if I run a couple of times, and then I'll notice the pain when I'm walking towards the end of the week, and it gets worse with each step as I walk into work.
Okay. Tell me more about what you are doing for sport and physical activity at the moment.
I ride my bike probably 4 or 5 times a week, not very far, maybe just 15 minutes each time, and I run probably 40 kilometers a week.
So, other than the riding and these long runs, do you do any other forms of physical activity?
Well, normally, I usually swim a couple of times a week as well. But I haven't been lately because I've been really busy at work.
Okay. And you said that you've had this for a few years. What initially brought it on?
I don't know. I think, when I was younger I used to play soccer and I had an injury where I dislocated my hip, and it was really painful. Yeah, I couldn't move for like a few weeks and I had a lot of physiotherapy and I had a lot of lower back pain after that for maybe a couple of years. But then it went away, and I haven't really had any major problems since then.
And, other than this dislocated hip on the same side, have you had any other major problems with your left leg, or with your back, or your hip or anything before?
Oh, no, nothing really.
How? I know that this has been going on for quite a number of years, but how long has this been a problem where you've sort of felt you need to do something about it?
I've been to an osteotherapist a couple of times about it in the past, just when it gets to this acute stage. So, this time it's only been like a few days that it's been really painful.
Okay, no worries. And what sorts of things did the osteo do for you in the past?
It was mostly putting pressure through that area, like massage, and then, think she used to just like poke her elbow into my left hip and hold weight there for ages until the spasming stopped.
Okay, no worries. How did you find the effectiveness of that?
It relieved it. So, basically what normally happens is it's still quite sore for a couple of days after I have treatment, but it doesn't feel so tight. And I usually have to rest off it. Yeah, for at least a few days, and then it's gone. Or maybe it's still there a little bit, but it's not like, doesn't get aggravated, and then it just drifts away.
Has your osteo given you any exercises in the past for this problem?
I do like a stretch where I kneel down and stretch through my front like hip flex area, and another one where I cross my leg, kind of on an angle like that, across my knee, and stretch through there, and I can feel that through my bum cheeks.
Oh, good. Have you found anything else that helps the pain go away?
Not really. I mean, if it feels really bad I can take maybe a Nurofen or something and it makes it better, feel a bit better, but no other sort of exercise or stretching.
Extract 2. Questions 13 to 24. You hear a general practitioner talking to a patient called Xavier Murphy. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Xavier. Come on in, and take a seat. My name is Anna Malcolm.
Oh, hello doctor.
Well, can you tell me what's brought you here today?
Well, to be honest, I haven't been feeling well for the past week or so.
That's no good. What sort of symptoms have you had?
I have had a fever for a few days and I have been feeling a little bit nauseous. It comes on worse in the afternoons as well.
Okay, and with the nausea, has sort of ended up with vomiting?
Yeah, I did vomit actually, both yesterday morning and this morning. That's one of the reasons I thought I'd better come and see you.
And, are you taking anything for that? Things like Panadol?
No, I haven't. I've just been trying to tough it out.
Okay, and what about your eating habits? Have you noticed any change to your appetite?
Yeah, well, I don't seem to be as hungry. I haven't been able to complete my meals without feeling a bit sick.
Right. And, what about any other aches, or pains generally?
I am feeling a little bit tired. And, I've had pain in my joints. I've been a little bit stiff in the mornings.
Okay, have you noticed any other sort of changes, such as yellowish skin or in the whites of your eyes?
Well, I didn't, but my wife commented this morning that she thought my skin had turned a bit yellowish.
Right. What about the color of your urine? Any changes there?
Now you mention it, I do think it's become darker in color.
Now, Xavier, I would just like to get some background details before we go any further. Are you married?
Yes, I am. I've got 2 children, my son is 7 and daughter is 10.
Oh, lovely. And, what about your employment? What sort of work do you do?
I'm an electrician, by trade. I work on building sites, and the company I'm currently work for now, has quite a few overseas projects. So, I do go overseas quite a bit with my work.
Okay. And, whereabouts have you worked recently?
Well, this year, I've been to Dubai. And, I've just came from there about 10 days ago.
I see. And, just tell me a little more about your general health.
Pretty fine, I think. I eat healthily. I haven't had any complaints.
And, do you smoke at all?
Yes, I do smoke. But, I'm trying to keep it under control, but, suppose I smoke about 10 cigarettes a day.
And, what about alcohol?
I have a couple of beers, most days. My wife and I are trying to be responsible. And, have a couple of alcohol-free days each week.
That's an excellent idea. That's very good. And now, just to go on to your family history, what about your parents? Are they in good health?
Yes, they're both in quite good health. My father, he retired a couple of years ago. But, he's fine. And, my mother. She's well, she does have high blood pressure. And, she does take medication for that, I believe.
I see, and do you have any brothers or sisters?
Yeah, I've got 3 sisters, and they're all well. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a pharmacist talking to a patient. Now read the question.
Hi, I'm dropping off a new prescription.
No problem, I have this in stock, but I do notice that this prescription is from the hospital. Can you tell me more about that?
Yeah, I was in the hospital for about 10 days. I need my refills as they didn't give me any new prescriptions in the hospital.
I did have auto refills for you in the pharmacy. Unfortunately, I had to return it to stock since you weren't able to pick them up. But, if you give me 20 minutes, I can get them all ready for you.
I twisted my ankle leaving the apartment this morning. It's hurting real bad.
That's terrible, especially since it's your first day coming back from the hospital. But I did want to talk to you about one thing. The ibuprofen that you're holding, especially with your medical condition, will have a tendency to reduce blood flow to your kidneys.
Really? They told me I couldn't take Tylenol, but I thought that ibuprofen would be okay. At the hospital, they said my kidneys weren't doing too good when I first got there. But when I left, they said everything was back to normal.
Question 26. You hear a discussion between a nurse and a physician explaining about Nipah virus. Now read the question.
Hello, doctor. Can you explain what the Nipah virus is?
Well, Nipah virus is a member of the paramic severity genus Henipavirus. This Nipah virus was initially identified and isolated in 1999 during an outbreak of encephalitis and respiratory problems among pig farmers and other people with close contact with pigs in Singapore and Malaysia. The name of the virus originated from Sungai Nipah, a village in Malaysia where pig farmers became sick with encephalitis. Initially, the disease was linked with Hendra virus, emerged from bats, but was quickly singled out for investigation, and flying foxes of the genus were subsequently identified as the reservoir for the Nipah virus.
Question 27. You hear a radiographer talking to a patient about her MRI scan. Now read the question.
Come in, come in. Mrs. Brown, isn't it? My name's Ted, and I'm going to be doing your MRI scan today. Now, can you get up on the table for me?
You know, I'm really claustrophobic.
Well, this is a new piece of equipment. The diameter is much larger, so it should make it a little more comfortable for you. You'll also have this call bell, so if you need me at any point during the test, you squeeze that, okay?
Okay.
Now, your scan's only going to take about 15 minutes. Are you okay with that?
I am.
Okay, let's get started then.
Question 28. You hear a nurse reporting to the doctor regarding a patient. Now read the question.
Hi, Dr. Walker. Yes, this is Carolyn Hall. I'm calling concerning Virginia Woolf in 347B. She's a para 1, gravida 1, and she has a massive amount of bleeding that saturated her bed and is pooling on the floor. Yes, and right now she's unresponsive and her blood pressure is 86/40. Her heart rate is 122, her respirations is 12, and her O2 sat is 90% on room air. Yes, she had an uncomplicated vaginal delivery this morning, and we gave her some Percocet and Ambien about 90 minutes ago. She has a saline lock on in her right arm, and it looks like a hemorrhage, and I think you should come and assess the patient.
Question 29. You hear a pharmacist talking to a doctor about a patient's medication. Now read the question.
Sorry to bother you, Dr. Anderson. I just wanted a quick word about Mrs. Campbell's prescription. The one for diphenhydramine that you gave her last week.
Ah, yes, for her allergies.
Yeah, so she's been taking 50 milligram tablets for about a week now. The thing is, she's just been into the pharmacy and she says that the tablets are making her feel really drowsy and her mouth's really dry, ever since she started on the pills.
Really? Well, that does happen from time to time. But maybe switching her onto a different medication wouldn't be a bad idea.
Okay, I'll look into some options and then run them past you later, shall I?
Fine, thanks.
Question 30. You hear two doctors doing an activity at a staff training day. Now read the question.
So, what did the trainer say we have to do?
Well, we've got to look through these case notes, 10 sets in total, and decide which of the patients should be referred to the consultant as a matter of urgency and which can wait.
Oh, right. And did I hear him say there's a limited number you can refer?
Not exactly. He said that we should put them in rank order according to the severity of the symptoms and other factors evident from the case notes. Once we've agreed on our list, we have to go and compare with another pair of trainees.
Okay. Let's get started then.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Professor John McNeil, who led a study on the impacts of aspirin. You now have 90 seconds to read questions 31 to 36.
It's been estimated that around the world there are millions of people who are otherwise healthy, have never had a heart attack or stroke, are not at high risk of bowel cancer, yet who take aspirin on a daily basis, convinced that it's going to help them. Well, the evidence from the largest ever study in this area suggests not. A huge trial called Esprit, involving healthy Australians and Americans aged over 70, given low-dose aspirin for 5 years, has found no benefits and some harms. The research was led by Professor John McNeill of the School of Public Health and Preventive Medicine at Monash University, who I spoke to before we went to air. Welcome to the Health Report, John.
Thank you, Norman.
It's pretty impressive, 3 papers in the New England Journal. What sparked this study? Because it was Australian motivated, even though it occurred in the United States as well.
I think we've been aware since the 1990s that there's an evidence gap, that many millions of people take aspirin every morning, and the evidence base, particularly for those who haven't had a heart attack or a stroke or have no other medical reason to be taking it, the evidence just isn't there.
So what did you do in this study?
We recruited 19,100 people from the United States and Australia. 16,700 were from Australia, and we followed them for an average of 4.6 years, and half of them took aspirin and half of them took placebo.
And what were you looking for? What were your endpoints?
Well, the endpoint here was disability-free survival, which is a measure of how long elderly people stay healthy.
But how did you measure that?
By measuring how long it took for people to remain healthy without having a permanent physical disability or developing dementia.
And what did you find?
Well, we found 3 things. Firstly, low-dose aspirin did not appear to increase survival.
Disability-free survival or survival?
Disability-free survival and survival. And it also didn't prevent heart attack or stroke. I think I should emphasise that this study was done in people who'd never had a heart attack or a stroke, because people who have routinely take aspirin under very strong evidence to prevent them having another one.
So we're talking about healthy people recruited who were over 70 on average, is that right?
That's right. The average age was 74.
What about cancer? A lot of people take aspirin to prevent cancer, and there is some randomised trial evidence that aspirin can prevent cancer.
Yes, this was a surprising finding in our study. There were numerically more people dying of cancer in the aspirin arm than in the placebo arm. This was a relatively small effect. It wasn't statistically significant once we adjusted for the multiple comparisons that we were making, and it hasn't been seen in other large clinical trials. So we're suspending judgment as to what its significance really means.
And what were the complications and the side effects?
Well, we had the usual side effect of bleeding. We took a lot of care over the measurement of bleeding because older people are more inclined to bleed, and aspirin enhances that effect. And we certainly had an increase in hemorrhage in the people taking aspirin.
Now, previous studies have suggested, and we had this on the Health Report, I think it was last year, suggesting that if there was a hemorrhage risk, it was early on and that settled down later.
We looked at this, but we couldn't find that. According to our data, the risk of hemorrhage just kept going.
Now, we had a story not so long ago on the Health Report suggesting that the effect of aspirin, of low-dose aspirin, is actually only there in people who weigh 70 kilos or less, and that if you want to get an effect from aspirin, you should be on a higher dose, like 325 milligrams or even 600.
We've had a brief look at that, and we couldn't find that in our older people.
What about dementia?
Aspirin appeared to have no effect at all on dementia.
But 4 years is not a long time to develop dementia. I mean, did you measure cognitive decline?
Yes, we measured cognitive decline very carefully, and we haven't analysed all the data yet, but certainly the number of people who were diagnosed with dementia was the same on each arm. But that raises a very important issue, because we will be following the people who participated in Esprit over the long term to see if there is a difference in incidence of dementia or cancer that appears later. And we know that there's been evidence that cancer preventive effect does take 4 or 5 years before it becomes evident. That's one of the reasons why we've been very keen for our Esprit participants throughout both countries to continue to be involved and let us follow them up.
Now, if you have hemorrhage or you have side effects like gastric upset or something like that from aspirin, the people who are taking the real thing might have dropped out more than people on the placebo. That could have affected the results?
We did a lot of testing of how many people were taking aspirin. We counted their pill bottles and so on, and we found that basically there was very good compliance with the medication on both arms of the study.
Could this be a phenomenon of, as we are getting older, we're actually not necessarily aging, we're actually living longer, younger, and we're getting less heart disease? Was this population too young, paradoxically, even though they were 75? Were they actually too young to get an effect? Because 75 is like the new 50, as they say.
That's an interesting question. We followed people whose commencement average age was 74 and whose final average age was nearly 79. So that's following people through a reasonably long period. We had a number of people who were over 80 years of age. And as far as we could tell, there wasn't a really big difference between the impact of aspirin at any of these ages.
So if somebody's taking aspirin now, they're entirely healthy, they've never had heart disease, they've not had bowel polyps, which is another reason why some people might take aspirin to prevent the polyps turning into cancer or new polyps emerging, and they're on aspirin, should they just stop?
Look, we're not recommending this at this point. People taking aspirin take it for three reasons. I mean, some, of course, as you said, have had a heart attack or a stroke or something similar in the past, and they should definitely be on aspirin because the evidence is strong. And then there's others who've been put on aspirin by their doctors for a range of other reasons, and they should continue as well, certainly not stop without getting advice from their doctor. But then there's the third category who may have just decided, they've read somewhere, they're perfectly healthy, they think it's a good idea. The results of a spree will lead these people to reconsider whether that's a good idea.
Just finally, do we know the numbers of people who are taking aspirin unnecessarily?
We know that it's much more common in the United States, where about 40%.
The date's wrong.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a physician giving a lecture on ankle fractures. You now have 90 seconds to read questions 37 to 42.
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle fractures. Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery if the ankle joint remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus fracture. Generally, a displaced medial malleolus fracture is treated with surgery. Bimalleolar ankle fractures involves both fibula and tibia that occur when there is an injury to both the inner and the outer side of the ankle, always resulting in an unstable ankle joint, and surgery is to be recommended for most of the patients with this kind of fracture. Even if the fracture heals without a perfect positioning, the ankle joint alignment will remain disturbed and could result in accelerated arthritis of the ankle. Even after a surgery, ankle cartilage can be damaged at the time of the fracture, resulting in arthritis. Therefore, a proper diagnosis and repair of these fractures is essential to avoid the chance of long-term problems. Although a bimalleolar equivalent fracture involves only fibula, there is also a tear of the ligaments on the inner side of the ankle, resulting in instability of the ankle joint. Therefore, a surgery is essential. Trimalleolar fracture involves both fibula and tibia like a bimalleolar ankle fracture. However, the bone in the back of the tibia called the posterior malleolus is also fractured. At times, if a large fragment of bone is fractured, a surgery is inevitable. Posterior malleolus fracture involves only tibia. This is a rare injury in isolation. Fractures of the posterior malleolus generally occur in association with bimalleolar ankle fractures. In such case, the injury is called a trimalleolar ankle fracture. Mesonerve fracture involves both fibula and tibia, which is a less common injury. However, this injury needs to be diagnosed thoroughly, as there are chances of missing this injury. In this type of fracture, the bone is injured on the inner side of the ankle, called the medial malleolus. The force of this injury passes through the large ligament that connects the two bones of the leg, called the syndesmosis. Since the damage is caused to this supporting ligament, the ankle becomes unstable, and most often a surgery is recommended.
That is the end of Part C. You now have 2 minutes to check your answers.